Now, here at Idaho News 6, we're dedicated to providing you with the important information, tools, and resources you need to know as we adjust to the new normal. It's what drives our rebound coverage.
Yeah, so imagine calling your doctor and you're trying to make an appointment only to be told that they aren't going to give you one. A new study from Idaho State University found that's 2 times more likely to happen to deaf and hard of hearing people. Idaho News 6's rebound reporter Natasha Williams sat down with the researchers behind the study. She joins us today with more in today's rebound report. Good morning, Natasha.
Good morning, Kristen, and good morning, Matt. That's right. This is a problem that the deaf community says isn't really new. They've been experiencing it for decades, but now they have the data to prove it.
We've heard some horrific stories about what people have experienced in this realm.
Dr. Elizabeth Schniedewind is a clinical associate professor for the interpreting program at Idaho State University. Her research stems from a problem the deaf community has experienced for decades.
Anecdotally, we have that data, but there has not been a measurement of how often people are denied these appointments, or when exactly that happens, or at which place it's more common for them to be denied an appointment.
Researchers looked at appointment data from several primary care physicians across Idaho.
Within that, we had a group of patients, simulated patients who could hear, and a group of simulated patients who were deaf. And we had them call the same list of doctors and dentists.
When they compared the data, what they found was shocking.
Deaf and hard of hearing folks being about 2 times more likely to be denied an appointment.
Researchers found much of that denial comes from not having an interpreter available. According to federal law, healthcare providers must provide an interpreter and make accommodations for deaf and hard of hearing patients.
Medical care is a right for all individuals, including deaf individuals. They have a right to have access to their own health care and have access to their own information. It is their lives.
Stephen Snow is the director of the Idaho Council for the Deaf and Hard of Hearing. He believes the issue is also a lack of awareness.
It's ignorance. Typically when we encounter this in my work, we'll reach out to the facility and explain that they need to provide an interpreter, and we explain how. And they often respond that they weren't aware that that was how they needed to do that.
Even with new research, there's still a lot of work to do.
There is so much more under the surface, and there are many layers to this issue.
There's still breakdowns, and there's still a lot of education and training across the clinic staff, from providers all the way to the medical assistant or whoever's making that appointment. They all need to have that understanding.
And this issue has become especially prevalent during the COVID-19 pandemic, as of course more and more of us are trying to make those healthcare appointments.
Natasha, so interesting. And how many deaf and hard of hearing Idahoans are out there?
There are about 200,000 deaf and hard of hearing Idahoans, and that's data from the Idaho Council for the Deaf and Hard of Hearing. But it's important to keep in mind, this particular study is only indicative of those who actually fight for their right to medical health care appointments. The Idaho Council for the Deaf and Hard of Hearing explained to me that a lot of people are so fed up with asking for access and asking for access and asking for access that they've just kind of given up.
Well, thank you for spreading that awareness this morning, and keep up the good work on that.